workers and the community from exposure to infectious agents and prevent the transmission of disease. You are already aware of infection control practices, such as using personal protective equipment like gloves, gowns, and masks, and giving safe injections. 3 additional infection control procedures include hand hygiene, safe handling of contaminated equipment, and respiratory hygiene. Hospitals have even more protocols, such as sterilization and disposal of infectious waste materials. We will only discuss the infection control guidelines, which are most relevant to obstetric ultrasound. It is ideal to hand wash before and after examining a patient, before putting on gloves for clinical procedures, and before leaving work. Hand washing should occur after arriving at work, direct contact with the patient, removing gloves, using a toilet or latrine, and any time that your hands may become contaminated. Please pause the video now to ask participants to explain more about their hand washing stations and if soap is readily available. This is a good time to problem solve as a group how to best accomplish hand washing throughout the day for each site. The steps in proper hand washing begin with thoroughly wetting your hands. Next, apply plain soap and vigorously rub all areas of hands and fingers, including fingernails and between the fingers. Rinse hands thoroughly with clean water. Using liquid soap in a dispenser is preferred over bar soap. Then dry hands with a paper towel, a clean dry towel, or air dry them. Use a paper towel to turn off the tap, if not elbow controlled or automatic. There are a few key points about hand washing. There should be an adequate water supply and liquid or bar soap. The health facility should have running water. Please think about how you may help improve hand washing practices in your workplace and how to adapt our recommendations to your workplace. Examples of some activities include discussing these recommendations with all staff, using regular monitoring and positive feedback, and using supportive supervision with all staff to promote compliance with hand washing. The next set of guidelines relate to the patient environment and ultrasound equipment. These are measures to prevent patient-to-patient transmission of infectious diseases. First, keep the exam table clean. Cover it with a clean sheet or towel for each patient if available. In some areas, patient clothing, such as a large scarf, might be used to cover the table. Clean any visible contamination with soap and water. Clean the ultrasound machine before and after each use. Wipe the screen with a damp cloth or tissue and then dry. Finally, clean the transducer after each patient exam. Wipe off gel, then wipe the transducer with a damp cloth and dry. Respiratory hygiene, or cough etiquette, helps limit the spread of airborne droplet infections between patients, family, and healthcare workers. Please cover your mouth and nose with the inside of your elbow when coughing or sneezing. Use and throw away tissues. Finally, perform hand hygiene after hands have been in contact with respiratory secretions. A few more key points to help limit the spread of infection. Please provide tissues and trash cans for their disposal. Provide areas to perform hand hygiene in or near waiting areas. Encourage persons with respiratory symptoms to wear a mask or cover their mouth with a cloth, and sit away from others. Educate fellow workers on the importance of infection prevention and control measures in all care settings and with all patients. We will reinforce these and other infection prevention and control guidelines during our hands-on sessions. Now we will discuss review questions. What is the purpose of infection prevention and control? The answer is to protect patients, healthcare workers, and communities from infections and transmission of disease. What are 3 things you can do to keep equipment clean and safe? The answer is hand washing, safe handling of potentially contaminated equipment or surfaces, and respiratory hygiene. How do you wash hands properly? The answer is to thoroughly wet your hands. Use soap, scrub, rinse, and then dry them or let them air dry. Use a paper towel to turn off the water tap. What is the proper way to cover your cough? The answer is to cover your mouth, use tissues, and then wash your hands. Thank you for your attention and interest